Tom Rounds. I'm a GP in London and an academic researcher at King's College with an interest in early diagnosis of cancer. And today I'm having a chat with Liz. Hi, Liz.
Hi there. I'm Liz Chipchase. I live in Cambridge. I'm a retired research scientist, and I was lucky enough to take part in a trial called the BEST3 trial, which introduced me to the cytosponge and led to a very early diagnosis of cancer for me.
Thanks, Liz. And we're having a little bit of a chat today about your experiences in the trial, taking part as a patient. Just tell me a little bit, obviously you said you're a research scientist, tell me a bit more about you and your health. Did you have any health problems before you took part in this study?
I was actually feeling very well when I took part in this study, but I do have a long-standing history of acid reflux, which I've had for about 40 years. So it had just become part of life. I took proton pump inhibitors to keep the acid down, and occasionally I'd have an endoscopy, but everything was always all right. So it had never really impinged on my life. I was just careful with my diet.
Mm-hmm. And you said you had how many endoscopies had you had before?
In the 40 years that I'd had it, I'd had an endoscopy approximately every 10 years. So I'd had 3 endoscopies, in fact.
And they were, and that was fine. Nothing had been found.
Nothing. No, they'd all been fine. So I was not in the slightest bit worried.
So you're sort of taking your so that would be sort of omeprazole, was it, or lansoprazole medication?
I was taking lansoprazole at that time. Yes,
okay.
yes.
So that's a commonly used medication for acid reflux, which a lot of as a GP would prescribe commonly. And then, how did you find out? Did you get a letter in the post or a phone call? What happened?
I had a letter from my GP surgery telling me that this trial existed and saying that I was a suitable candidate because I had acid reflux and because I hadn't had an endoscopy recently, and would I like to take part? And it described the Barrett's esophagus, which is what the test is looking for. And I'd never actually heard of Barrett's esophagus. And I'd actually worked on cellular transformation, so I was quite interested in the idea of cells inside the esophagus changing as a result of acid treatment and becoming precancerous. The actual cancerous aspect of it didn't affect me, didn't impinge on me at all. I was just interested in the fact that cells could, from in the upper part of the esophagus, could change into something that looked more like something from lower down in the digestive system. So I just thought, well, that's interesting. I read a few papers about it and thought, oh, I'll take part. I'm fine. I'm obviously not a candidate for this, but everybody needs a control in their experiments.
And how did, I mean, obviously some people get the letter and maybe when you first saw it, had you taken part in research studies before, or is this the first time you've been invited to take part?
No, I had taken part in, I'd taken part in a blood transfusion experiment where they were looking at intervals between donations. And I'd also given my name to the NIHR department in Cambridge, who were actually interested in people who would volunteer for trials. So my name was on that, but I don't think that had anything to do with me being selected.
So when you got that letter, then did you you thought, okay, this sounds like you felt it sounded interesting, might want to take part?
That's exactly so. The other thing was that it was so simple. It only involved going to your to a nurse at your GP's surgery. And it was an extremely simple test to understand. You know, when somebody's offering to let you test out a drug or something, requires a bit more thought. But if all you've got to do is swallow a pill that's attached to a string that's going to be retrieved, that's not a problem. It's so easy.
So talk me through that process then. So you sort of said, okay, I'm going to take part. Did you kind of ring in and you booked an appointment?
I rang the surgery, made an appointment with a nurse for about a couple of weeks' time. I think the appointment was for about half an hour. And I would say a good half of that was involved in filling in all the consent forms. And then the nurse, it was early on in the trial, and the nurse was actually being trained at the time. So I had 2 people to help me do this. And I swallowed the pill. on its little string, which I was slightly worried about the string, but in fact it's such fine cord that you hardly notice it's in your throat while you're waiting for the capsule to dissolve. That takes about, well, it takes 7.5 minutes precisely to dissolve. And then the nurse whisks it up so it goes through the whole length of your esophagus and out of your mouth. It's at that point, I must say, that you realise calling it a cytosponge is a little bit of an anomaly, because it's definitely a cytoscara. You can feel it go all the way back up, but it's not uncomfortable, and it's very, very quick. So it's out of your mouth before you've realised.
So that was a quick experience coming out. And how did you find that process? You'd obviously had endoscopies before. How did you find it compared to things you'd had before?
It really doesn't.
Or the dentist or something like that. You know, people are scared of pain and things, and
it's infinitely less than an endoscopy. It's infinitely less than going to the dentist and having a tooth poked. No, it really is painless.
So you felt fine, and you kind of finished off.
Absolutely.
And then how did you feel after it? You said, "Oh, I've taken part." Are you kind of left thinking more about it, or?
No, I just walked home, had a cup of tea to sort of clear my throat, and I thought absolutely no more about it at all, until I got a letter a couple of weeks later saying that the test had come back as positive for Barrett's. But it was a very soothing letter which said, you know, this is of no real consequence, but we would advise you to have an endoscopy to check that result. So I did have an endoscopy about 8 weeks later.
And that was that sort of, they directly booked you from the trial into that?
Yes.
Yeah, okay. And obviously you'd had endoscopies before, so you probably weren't so... Were you nervous beforehand, or
no, not really. No, I mean, I know endoscopy. I never think endoscopy is particularly pleasant, but I'm not worried about them. And it was actually only while I was having the endoscopy, because I'm always interested. So I was having a look at the screen to see what I looked like on the inside, and I could see that this looked different from the previous images I'd seen of my esophagus, because it was extremely inflamed, and in one area which the endoscopist spent a lot of time poking around in, was bleeding and looked pretty horrible. So it was at that point where I began to think, oh, that's not looking very good.
And so did you question that then, or what was the sort of, how was it left after your endoscopy?
Oh, well, the endoscopist told me that this area was obviously very inflamed, and I ought to go on a much higher dosage of the proton pump inhibitors. So he then prescribed a high dose of omeprazole for me. So I started taking that immediately, and a couple of weeks later, I was called into a clinic to talk to Professor Fitzgerald and her team.
Did you have an idea then that if they'd called you into clinic?
Once I got called back into the clinic so quickly, I thought this doesn't look good. But and so I suppose I had at that point begun to think about that it might be cancer. But it's not until somebody actually says those words to you that you really believe it.
Yeah. So it was. Yeah. Talk us through. Was that a sort of? Did you take in was it a big shock, or did you have someone supporting you there at that time?
No, I was on my own. I prefer to go to these things on my own. And although I'd already thought about it, it still is a shock when somebody says those words. And I was handed out, I was introduced to a nurse who I could contact at any time. I was introduced to a couple of endoscopists, and I'm given a booklet. But at that time, you're really still in a state where you can't think of the right questions to ask, I think. It needs a little while to absorb that information. So I was very fortunate in that my treatment continued quite quickly. For about a fortnight, I was thinking about it, and the thoughts that go through your head when you're told you have cancer inevitably are, this is going to be I'm likely to die because esophageal cancer is very invasive quite quickly, I think. And I think it's about 17% of patients survive for 5 years. So you have that in mind immediately, that I'm going to die much earlier than I thought. You also think of the treatment, so you think operation, chemotherapy, and all the same things that are associated with that, maybe radiotherapy. I'm going to feel awful, whatever the outcome. So I was lucky that I was only thinking of those things for the first 2 weeks or so. Then I had another endoscopy and more biopsies were taken. And I was told at that stage that it was still confined to the single layer lining the esophagus. It hadn't yet penetrated deeply so that it could be treated endoscopically, which was very good news.
And did you have support around you from your family and friends at that time? Had you told? Did you? You said you went on your own. Did you tell people then?
I did. I thought about it for probably about a week, because I did want to tell my husband and son at the same time, because I knew that I could guess what their reactions were going to be, and I didn't want to have to do it twice. So I got them together after a week or so and told them. And at that time, I was still thinking that, yeah, I could die from this. And they responded exactly as I thought. My son gave me a big hug and said, "I'm there for you, Mum." And my husband said, "Oh, would you like a cup of tea?" Which was something I did want, but yeah, that was fine.
And then obviously then things changed for you a bit, because then what you felt was could be a potential death sentence. It sort of switched, didn't it? As you said, it maybe, thankfully, it sounds like it was local cancer, which then you offered treatment. So talk us through that process. How did that work?
It's a treatment called an endoscopic resection, and I actually had this in about December, I think, of that year. And for the patient, it is really a very simple process. It's just like having a normal endoscopy, except in this case, I was sedated, so I didn't know what was happening. And basically, through the endoscope, the cancerous area is lifted up away from the underlying tissues by suction, and then it's nipped off. And so the cancer's removed. And that, I think that in my case, the cancer area was large enough to require quite a lot of suction. So I did, in fact, have to stay in hospital overnight just to have the bleeding checked and the area where it might have been a bit of muscle damage checked. But in fact, I was fine. So I was released the next morning.
And what's happened since?
So
this was, we should say, what year was this? So how long?
This was in December 2017.
Okay. So coming up to 3 years.
Yeah. But in fact, when I had the next endoscopy and more biopsies, which was in February, I think, of that year. No, it was earlier than that. I was told that there were still cancer cells present, so it hadn't been cleared completely. And also that at that point, it did become a bit more touch and go, because the one of the biopsy samples showed that the cancer cells were in intimate contact with the next layer down. And so there was a chance that somewhere along my esophagus, cells had already moved into that underlying layer and could then obviously be transported around my body. So at that point, I was offered 2 treatments. I could either have another resection, or I could actually have my esophagus removed. If I had the latter, then definitely the cancer would all be cleared. If I had the resection, the much milder treatment, there was still a chance that not all the cancer would be cleared.
That's a tough choice.
Yes, it was. I mean, the surgeon talked to me and the endoscopist talked to me together. And reading the risks attached to having your esophagus removed compared to a resection takes half a day in outpatients, basically. having your esophagus removed is going to mean at least a week in hospital, but probably a short period in intensive care. And it takes 6 months to a year before you feel normal again. And of course, you're never really normal, because what's replaced your esophagus is your stomach's been stretched up to replace the area that's been removed. And so your body is going to be changed forever. So I thought about it and decided that I would go for another resection. At that time, backstops were all the rage. We were looking at Brexit backstops. So I thought that maybe I could bring in this principle and have the operation as a sort of backstop in the back of my mind, as something that if the resection didn't work, I would still be there.
And that process, you recovered okay? It was
Yep, absolutely. I had the second resection, and that went very smoothly, and I was absolutely fine. There were no problems with it at all. I mean, after a resection, you have about a day on liquid food and then soft food for a week. That's the greatest inconvenience, which is nothing.
And how are things with you now? Because obviously we're now sort of reflecting back, but how are things sort of with you at this current time and going forward?
It's been absolutely it's been very interesting, actually. I mean, I had endoscopies, I should think, once every 3 months, with biopsies being taken to check that everything was okay, and it became obvious that things were okay. So I'm now down to 6 monthly endoscopies, which are somewhat interrupted by COVID, but they're still going on. After in early 2018, I was asked if I would be prepared to let my story be used for publicity, and that in itself was very cheering, because they wouldn't have used my story for publicity if they thought there was any risk of a recurrence in the immediate future. So I've been doing a certain amount of that since.
And that's how we first met a couple of months ago,
right, yes.
When we could meet in person.
Yeah.
Yeah, I mean, how does it feel now to be sort of through that if you were reflecting back through that lived experience, and actually you've become an expert patient, and someone who's telling us that amazing story. How does that make you feel?
What the whole thing, that I would say that actually cancer has been a positive experience for me. It does make you appreciate what you've got. It makes you appreciate your good health, and everything you look at that you enjoy, you think, I could have missed this, so I'm going to make the most of it now. So I think it enhances your life in that respect. And although I was very dubious about the publicity, and I'm not at all sure about my abilities to speak in public, I have actually quite enjoyed that as well. I've been to various parts of the country to give talks about the patient experience, and it's been very interesting. I must say I was horrified to walk into a supermarket and see my picture on the front of the local newspaper when the first press release was released. But I've got used to that now.
And obviously you've told your story, and I guess the sort of, what lessons would you take home from this? If anyone was, worried about symptoms, what would your sort of advice be to them, especially during COVID? We've seen a lot of people maybe worried about not bothering doctor's time, or they're scared of using the NHS, especially for potential worrying symptoms.
Well, I think if you've got any worrying symptoms, then you should go and see your GP, or go and talk to your GP, because I think my experience has shown that if you can catch cancer early enough, then it can be cured. And I would advise people, if they are offered tests, to take them up, because at the present moment it is difficult to have things like tests for breast cancer and for cervical cancer, for example. But if those tests are available, take them. It's It makes such a difference. You can't feel cancer developing inside you at an early stage. That's the trouble. You can't feel cells dividing until they have produced something that's large enough to actually impede your normal functions. And by that stage, it's advanced. So although you may actually feel perfectly well, if you have any thoughts that you've got cancer or anything wrong with you, get it checked.
That's a great, thank you. Thanks. I think that's probably, I think that's a good place to end on, unless you, I guess we did a bit of reflection.